Hi there everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is trichotillomania, also known as hair pulling disorder?
Ooh, ah.
Alright, let's get into what trichotillomania, also known as hair pulling disorder, is. Just before I get into that, there's one little thing I have to say, which is that this is not the diagnostic criteria for trichotillomania. It's just a description to kind of give you an idea of what's going on when we mention hair pulling disorder. If you need a diagnosis, you'll have to see a licensed professional to get that, but this is just here to provide you some information to see if that's kind of maybe where you're leaning towards when we're talking about these behaviors. And if the label of trichotillomania or hair pulling disorder bothers you in any way, if it doesn't help you to heal, if it causes you stress, you don't have to use the label. You can drop the label. Really, we're just trying to point you in a direction of something that may be going on in your life or the life of someone that you love. So that out of the way, what is trichotillomania and hair pulling disorder? What are we talking about? So I've got some notes just to make sure I've got things correct here. And it is a recurrent pulling of your own hair, resulting in hair loss. Now, the hair loss may not be visible. You may see like a patch of hair, but it may be that you pick from different places. So there could be significant hair loss, but it's not obvious that there's hair loss. And the hair can be from any part of the body. It doesn't have to just be the hair on your head. It could be eyebrows, eyelashes. It could be hair on your body. Anywhere you can imagine that hair is growing, that could be where you're pulling from when we're talking about hair pulling disorder. Now, there is going to be attempts to stop pulling or decrease it because it causes stress and it interferes with your everyday life. And it's not something that's due to a medical condition like a dermatological condition, and it's not better explained by another mental disorder, for example, body dysmorphic disorder. There is treatment for it. You would use cognitive behavioral therapy, habit reversal training, or possibly medication. And it's not like regular playing with hair, biting hair, or normative grooming. This is different in that the hair has to actually be pulled out. So what's happening when we're talking about trichotillomania? In the body, the way you're experiencing it is anxiety symptoms. So anything like a racing heart, shortness of breath, joint pain, any of that kind of a thing when you feel this urge to pull the hair. And that's another part of what you'll feel in the body is you may feel like an itch or an urge to pull. There's going to be some kind of hair loss, potentially in a pattern, and likely there's not going to be like pain when you're pulling out the hair. Something else you may notice is that there may be a lack of eyebrows or a lack of eyelashes in somebody who does this more often in those areas. There doesn't seem to be anything cognitively that's going on in your brain and your thoughts, really, when we're talking about trichotillomania. If you have some insight, if you're somebody who suffers from this and you find that there are thoughts that go through your head, I'd love to hear them, so leave those below. Emotionally, you may feel a little bit embarrassed about this. You may feel kind of out of control, shamed. You may feel like you're bored or you're stressed before you start to pull, and you may feel relief after you pull. Now, behaviorally, you're probably going to pull the hair out from any part of your body. That's what the disorder is about. It may be something that happens in brief bouts or a more continuous period throughout the day. There could be a ritual associated with hair pulling, like certain colors of hair, maybe pulling it out without breaking it, rolling the hair between your fingers or biting on the hair. You may avoid social situations because of this. You may have trouble at work or school because it's distracting. You may pull hair or have the urge at least to pull hair from other people, pets, dolls, fibrous materials like a sweater or a material on a piece of furniture. And you may also, in addition to hair pulling, skin pick, lip chew, or nail bite. So that's what hair pulling disorder, trichotillomania, is. I hope that's given you a quick, little, good, well-rounded perspective on what it is. It is stressful for the person going through it. It's not like a little joke or a phase or anything like that. It's serious. So if you find that you're experiencing it or someone you know is, I would urge you to find someone that can help you with it. And I thank you for learning about trichotillomania with me today. Thank you. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.